I'm Nicole Alond, and I'm in my fourth and final semester at the UAB School of Public Health Epidemiology program. I've been an intern at the Kosciuszko County Health Department within the Communicable Disease program. I worked alongside communicable disease nurse Teresa Reed. Kosciuszko County is a county in the northeastern part of Indiana with a population of about 80,000 people. The health department I worked in had a mission to promote, protect, and improve public health of all Kosciuszko County citizens and visitors in a cost-effective and servant-like manner. For my internship, I worked with the community to promote the health and well-being of the population and to identify current diseases. This is important to the community because many do not realize the impact disease control has. We work to prevent, identify, and treat any communicable diseases. Healthcare providers are required to report all Indiana reportable diseases to the health department. The system we use is from the CDC and is the National Electronic Disease Surveillance System. When we would receive reports, we worked through each specific case, whether that be a hepatitis, Campylobacter, Salmonella, Cyclosporia, or any other communicable disease. It was essentially like a puzzle. We would gather doctor's notes, labs, and any other pertinent medical information. Then we would reach out to the cases and ask questions specific to each disease. When cases were completed, we submitted them to the Indiana State Department of Health for further review and analysis. Overall, this internship has taught me how to effectively interview and communicate with individuals from different cultures. I also learned that the medical information we often need for epidemiological purposes is difficult to gather. However, I did become very proficient in using the communicable disease reporting systems, and this also required me to understand and apply CDC case definitions. Yet I did quickly face a challenge I had to work through, and that was the lack of medical knowledge I had about diseases, transmission, labs, doctor's notes, and especially medications. This was something I was able to work through with my preceptor, and I gained beneficial medical knowledge that I would have otherwise not gained from public health courses. I was able to work with community to prevent transmission and to educate individuals about many diseases. The first day of my internship, I went to a jail to administer hepatitis A vaccines in response to a potential exposure at the jail. I was able to visit an Amish family's home to provide timely vaccination and exposure to chickenpox. We were even able to go to elementary schools to check preschoolers' blood lead levels. I was also able to go into the community and visit local vape shops to educate them on the new vaping illness. One of the more prominent visits to the community was when we went to a first responder career fair and spoke with students about hepatitis A, the vaping illness, Lyme disease, and many other diseases. The picture on the poster is from the career fair, and the 2 flyers posted on the poster was a hepatitis A flyer I made to hand out to the community. Other project outcomes I completed but are not presented was an annual executive summary of data and epidemiological concerns from our reporting system to the Board of Health. I also completed a lay summary for the community regarding the new vaping illness. But most of all, a lot of our community work has been done through education and interviews with cases we received. These interviews allowed us to help build a trusting relationship with the community, especially in high-risk populations. It also allowed us to communicate and try to promote vaccines or preventable measures for communicable diseases. Overall, my main task was to perform case interviews and monitor urgent public health conditions and to communicate to the community the importance of appropriate responses and preventative measures. I would like to acknowledge Teresa Reed, communicable disease nurse and my internship preceptor in the UAB School of Public Health. Thank you.